It can be quite concerning when your child starts coughing or making that distinct wheezing sound, and it is natural to wonder what might be causing it. Yes, a child's cough and wheezing can absolutely be symptoms of an allergy. These reactions are often the body's way of responding to allergens, which are typically harmless substances that the immune system mistakenly identifies as a threat. When a child with allergies encounters a trigger, their immune system releases chemicals like histamine. These chemicals can cause inflammation and swelling in the airways, leading to the familiar symptoms of coughing and wheezing. The cough is often an attempt to clear the irritated airways, while wheezing is a high-pitched whistling sound caused by air struggling to pass through narrowed breathing tubes. However, it is important to remember that these symptoms can also be caused by other common issues, including viral infections like colds, asthma which often has an allergic component, or even irritants in the environment. To help determine if allergies are at play, carefully observe your child's symptoms. Notice if the cough and wheezing appear after exposure to specific things, like certain foods, pollen, dust mites, or pet dander. Keep a record of when and where these symptoms occur, and if they are worse during particular seasons or times of day. This detailed information will be incredibly helpful when you consult with your pediatrician. Your doctor can conduct a thorough examination and may recommend allergy testing to identify specific triggers. Understanding the underlying cause of your child's cough and wheezing is a crucial step towards effective management and providing them with greater comfort. Knowing precisely what triggers their reactions allows for targeted avoidance strategies and appropriate treatment plans. This proactive approach can significantly improve their daily life and minimize discomfort. Ultimately, recognizing patterns in your child's symptoms and seeking a professional diagnosis are key steps. Once the cause is identified, whether it is an allergy or something else, you can work with your healthcare provider to develop the best plan to manage their cough and wheezing, ensuring your little one breathes easier and feels better.